Okay, before using this video, I'm going to receive consent from Courtney. Courtney, this video is being used for educational purposes only. It'll be shared with my professor for my nursing class. It will not be shared publicly. Do you agree?
Yes.
Okay, perfect. So upon arrival, I saw Courtney. Courtney was dressed appropriately for the weather. Her behavior is normal. Her mood effect is normal. She wasn't crying. She wasn't angry. She is appropriate for the situation. I took her health history, and I could see that she answers appropriately. Her speech is clear, and she is not aphasic. Courtney, can you tell me your full name and date of birth?
Courtney James, October 13th, 1977.
Okay, and can you tell me where we are right now?
Des Plaines, Illinois.
Okay, and can you tell me why you are here?
I'm here for my yearly exam.
Okay, and can you tell me what year it is?
2025.
Courtney is alert and oriented ×4 to person, place, time, and situation. Okay, so Courtney, I'm going to ask you you to interpret a saying that is common. Just let me know what you think of when I tell you this phrase.
Okay.
So the phrase is, don't judge a book by its cover. What does that mean to you?
Not to judge somebody on the outside of their appearance.
Correct. So her abstract thinking is normal, and it was an appropriate response. We checked Courtney's cranial number 2, her visual acuity with the Snellen chart. She has 20/20 vision in both eyes, which means that she was able to see clearly the Snellen chart from 20 feet away. Next, I will check cranial number 3, 4, and 5. We'll start first with checking her pupils. Courtney, I'm going to shine a bright light in your eyes, okay?
Okay.
Open. Good. Courtney's eyes constricted immediately. We'll do this one too. Ready?
Mm-hmm.
Good. So Courtney's pupils are equal, round, and reactive to light and accommodation. I'm going to have you follow my finger, okay? Don't move your head. Good. Good. You're checking the cardinal fields of vision, and they are intact. I'm gonna close one eye, okay? And I'm gonna put my finger and place it closer to your eyes. When you can see it, let me know when, okay? Just say now.
Now.
Good. We're checking her peripheral.
Now.
Good. I'm looking at Courtney's sclera. It is white and shiny. I'm going to pull down your eye. Pull down your eyes. I'm going to check for her conjunctiva. I see that they are pink and moist. I also see that her eyebrows are symmetric. This is a normal finding. So cranial number 3, 4, and 5 are intact. Also too, her cornea, we don't see any opacities. I don't see any cloudiness. So this is a good sign, and this is normal. Next, I'm going to check cranial number 8, which is her hearing. Courtney, I'm going to whisper 3 things behind your ears, and can you repeat them after I tell you them, okay?
Okay. Apple, banana, orange.
Good.
Car, motorcycle, truck.
Beautiful. So her hearing is intact. Next, we're going to do the Rhine test. So I am going to strike this tuning fork. I'm going to put it in the back of your ear. Let me know when you stop hearing it.
Okay.
Once you stop hearing it, I'm going to move it in front of your ear, and you let me know when you stop hearing it. Okay?
Okay.
Hold on, let me do that again. There we go. That's better.
Okay. Okay.
Okay. So Courtney was able to hear air conduction longer than her bone conduction. This is a normal finding. I will do the same thing on this side of the ear. Same thing. Let me know when you stop hearing it, okay?
Okay. Okay.
Okay. Okay. She was able to hear air conduction longer than her bone conduction. Again, this is a normal finding. I'm going to do this one more time. I'm going to strike this, but this time I'm going to place it on top of your head. So let me know if you can hear it equally on both sides, or if you're hearing it more on one side than the other. Okay?
Okay.
Ready?
Equally?
Beautiful. So this is a normal finding. Next, I'm going to do the Romberg test. Courtney, can you stand up for me, please? Okay. I'm going to ask you to close your eyes. Do you feel any dizziness?
No.
Courtney's not swaying. She's not stumbling. So this is another normal finding. Cranial number 8 is intact. Okay, you can have a seat. Next, I'm going to check her tympanic membrane. I'm going to stick this tool in your ear, okay?
Okay.
I'm just going to check to see how what your eardrum is. I can see that her tympanic membrane is gray. It is translucent. I see a little bit of cerumen, so that is a normal finding. There is no bulging, no redness, so this is normal. We're gonna go to your next ear, okay? A little tug at your ear. Okay. I see that this ear too as well is gray, translucent. I can see the cone of light. I can see the reflection. I was also able to see the reflection on this side of the ear too. There is no redness, no bulging, a little bit of cerumen, which is a normal finding. So cranial number 8 is intact and good. Okay, we are going to do a quick neuro assessment now. I'm going to start with cranial number 5. Courtney, can you clench your teeth? I'm going to palpate her masseter, and it is strong and it's symmetrical, and then her temporal. It is symmetric. Courtney, can you close your eyes? We're going to check for sensory. Tell me when you can feel the object, okay? Just say now.
Now. Now. Now. Now. Now. Now.
Good, okay. I'm going to place a sharp object or touch you with a sharp object and a soft one. Just let me know if you feel sharp or soft.
Sharp. Soft. Sharp. Soft. Sharp. Sharp.
Okay.
Soft.
Good. Cranial number 5 is intact. So we're going to do cranial number 10. Right now, I'm going to elicit a gag reflex and check the back of her throat. Could you open your mouth, please? And say ah. Yes, good. I see that your uvula is midline and everything is pink and moist. Now I'm going to elicit a gag reflex. I'm going to try not to do it too much. Okay. Cranial number 10 is intact. Her speech is clear. She is not aphasic, so this is normal for cranial number 10. Now we're going to assess for cranial number 7. Courtney, smile real big for me. I can see that her smile is symmetric. I see that her nasolabial folds are symmetric. Also, too, raise your eyebrow for me. Perfect. So we see some symmetry in both of her eyebrows. Next, I'm going to assess cranial number 11. Can you stand up for me? I'm going to have you walk towards the window and walk back. Okay, perfect. Her gait is even and balanced, and has her balance is intact. When we look at her back has no curvature, no kyphosis. That's a normal finding. If you can sit down, I'm going to have you push against my hand. Good. Push against my hand. Perfect. Now I'm going to have you shrug your shoulders for me. Good. Both is symmetric. So cranial number 11, cranial number 11 is intact. Now we're going to check for cranial number 12, the hypoglossal. So if you can open your mouth, stick out your tongue, move it left to right, and stick it back in, and push again your tongue against your cheeks, both sides. Beautiful. Cranial number 12 is intact. If you can put your arms out for me. I don't see any tremors. This is a normal finding, and this is all for my neuro check. Okay, next we are going to do a pulmonary assessment. When Courtney was standing up, I could see that her AP and transfers ratio was 1 to 2, which is a normal finding. There was no barrel chest noted. I counted her respirations. Her respirations are 18 breaths per minute. She is not using any of her accessory muscles, and her breathing is even and unlabored. I'm gonna auscultate her vesicular sounds. Stethoscope is warm. Take a deep breath. Exhale. Good. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Can you lift up this arm for me, please? Inhale. Exhale. Good. Inhale. Exhale. Vesicular sounds were soft, which is a normal finding. Next, I'm going to check for her bronchial breaths, and it's located at the trachea. Inhale, exhale. Next, her sternum for the bronchial vesicular sounds. Inhale, exhale. The bronchial sounds were loud, which is a normal finding, and her bronchial vesicular sounds in her sternum were medium, which is a normal finding. Next, I'm going to have you stand up, Courtney, and we're going to turn the chair around. And if you can sit down, can we see there? I'm going to check for tactile firmness, and also I'm going to check for vocal resonance. Every time I put my hands on your back, just say 99 for me, okay?
99.
Good.
99.
Good.
99. 99.
Good. So tactile firmness and her vocal resonance is normal and symmetric. Next, I will check for thoracic expansion on her 10th rib. Take a great big breath and exhale. Good. Both of my hands rose symmetrically, which is a normal finding. Next, I will do a cardiac assessment. I already checked Courtney's heart rate, and her heart rate was 85 beats per minute, which is a normal finding. There was no murmurs, and there was no clicks heard, or no friction rubs, and this is a normal finding. We will auscultate for S1 and S2. Auscultating in the aorta, the pulmonic, tricuspid, and the mitral. I'm going to go right up there. S1 and S2 we can hear in the tricuspid and the mitral, and then S2 or S3 and S4 was heard in the aorta and the pulmonic. There is no murmurs or no friction rub, and this is a normal finding. Courtney, I'm going to palpate her radial pulses. It is equal and strong, which is a normal finding. There was no edema noticed on her legs, her feet, or her arms and her hands. And this is it. Thank you.
You're welcome.
Okay, next I am going to assess her meningitis by performing the Brzezinski and the Krennig. And after that, I will be assessing her abdomen. We're going to start off with the Brzezinski. I'm going to lift up her head. Courtney, I'm going to place my hand behind your head, and I'm going to lift it. As you see, there's no involuntary, you can put it down. There's no involuntary hip or knee flexion. Next, I will do the Krennig test. I am going to pick up your leg at a 90 degree. Go ahead and, there you go. I'm going to pick up your leg, and there is no resistance, which is a normal finding. We'll do it again, 90 degrees. Can you bend your leg? There you go. With resistance, no resistance. This is negative. So she is negative for meningitis. As I'm looking at her abdomen, she has no distension, which is normal. I'm going to right now auscultate her bowel sounds. All four quadrants of the bowel sounds are active. Next, I am going to auscultate for her aorta pulse, and that's 2 centimeters above her umbilicus with the bell of the stethoscope. I don't hear any bruits. Next, we're going to check her renal arteries. And again, I hear no bruits, so this is a normal finding. Next, I will be percussing for tympanic sounds. Okay, I can hear all the tympanic sounds, and this is a normal finding. Next, we're going to palpate. Courtney, I'm going to palpate your abdomen very lightly, okay? It'll go from light, and then we'll do a deep palpitation. And let me know if you feel any pain. Are you feeling any pain?
No.
Okay, good. Okay, now I'm going to go deeper, okay? Let me know if you feel any pain. No pain still? Good. Okay, I don't feel any masses or any lumps, so this is good. This is a normal finding. Next, I'm going to check for her liver span. I'm going to start from her lower right quadrant and go up and until I hear dullness. I will mark it with a pen. Okay, and then I'll start from the top. Again, listening for dullness. Oops, sorry. And I will measure with centimeters. The liver span is 6 centimeters, and this is a normal finding. Next, I will assess for kidneys. Courtney, I'm going to have you, when you inhale, I'm going to ask you to hold it, okay?
Okay.
So I'm going to palpate for your kidneys. Go ahead and inhale and hold it for me. Okay, I do not feel her kidneys, and this is, you can go ahead and breathe. I do not feel her kidneys, and that is a normal finding. I'll go on the other side. Okay, Courtney, go ahead and inhale for me and hold it for me, please. Again, I do not feel her kidneys, and this is a normal finding. Thank you.